Hello everyone, I am Dr. Yazhini, an MD Anesthesia graduate from Safdarjung Hospital, New Delhi. Today, I would like to discuss with you about anesthesia as a career option. Anesthetist, बेहोश करने वाले, माइका मरिंद डॉक्टरा. This is how people used to react whenever we told them our occupation, let them be from general public or from the medical community. But now times are changing and people have started realizing our importance. Today, I hope this video will bring some muscle relaxation to those still frowning corrugator supercilii. First, I'll start with what is anesthesia. Except for the very few pages at the end of our MBBS surgery book we read, the very few days of posting we attended during our internship period, the very few questions we concentrated during our preparation period, we know very little about this subject. The common notion is that anesthesia is nothing but putting the patient to sleep and making that part of the body numb to surgery. But absolutely not. Anesthesia is a broader specialty with a vast array of subspecialties like OT based anesthesia, operation theatre based anesthesia, critical care or intensive care medicine, palliative care pain medicine, and emergency medicine. Emergency medicine is a separate course in some hospitals. First, OT based anesthesia. Here you are going to be the preoperative, intraoperative and immediate postoperative physicians of the patient. So state lovers, here comes your job. You are going to preoperatively optimize, that is, make the patient fit enough to endure surgery both physically and mentally. Intraoperatively, we have general anesthesia, regional anesthesia, which includes spinal, epidural and monitored anesthesia and also monitored anesthesia care. And we have nerve blocks also. If you are a lover of physics and machine, here comes the snack to feed your love for physics and machines, the ventilators, USG machines and defibrillators and much more. The critical care of postoperative sick patients is done in PACUs, that is post-operative post-anesthetic care units, PACUs, which are run by our department in most of the colleges. In some colleges like those in Delhi, the medical ICUs are also under the Department of Anesthesia, and we get around 10 to 12 months of solid exposure to ICUs. So if you are pondering or wondering how to pursue your passion in critical care, now that your rank or score is not that good enough to fetch you a general medicine seat, then anesthesia is your next best option. In ICUs, you'll learn resuscitation and critical medical management of the patients, procedures like central venous access, invasive arterial line access, percutaneous dilatational tracheostomy, POCUS, which is point of care ultrasonography and much more. And in emergency medicine, you'll learn life-saving procedures like intubation, CPR skills, defibrillation, tracheostomy, cricothyroidotomy, etc. And depending on the facilities available in your institute, you'll also learn basic sonographic skills like FAST. And depending on your own interest, you might also get a chance to learn procedures like chest tube ICD insertion, tracheostomy and even foreign body removal. So anesthesia is one among those very few specialties where you get immense satisfaction of being a life-saving doctor when you secure an airway or even a difficult IV access when everyone else fails to. And the last and the most promising and developing field is the pain medicine. Here we have nerve blocks, which can be even sole anesthetic option for surgeries, or supplement general anesthesia, or for chronic pain management of cancer patients. And we also have prescribing opioids and other interventional methods to treat intractable pain. So now you might think, okay, she is bluffing. All I have seen is anesthetists always scrolling WhatsApp behind their drapes and gulping gallons of chai and coffee SOS. That's because you just saw, you never observed. And that is the very essence of anesthesia. The eyes can't see what the mind doesn't know. So even monitoring a monitor is a very great skill. So this is anesthesia, not this. Okay then, who should choose anesthesia? To be a good anesthetist, you should have two main qualities. One is dexterity, that is how skilled you are with your hands. And the next one is mental agility, that is how quick you can think. That is commonly simply told, it's your presence of mind. So this means that you should have the qualities of both a physician and a surgeon. That is the uniqueness of this field. Next is what to do after getting into anesthesia. This is my very first advice is, don't get into the hibernation mode now that you have worked very hard and secured a good rank and have got into that creamy layer that is the PG population. This is a general advice which works for almost all the courses, but especially in anesthesia, since our work pattern is also lets us relax, we tend to become lazy and sluggish. Anesthesia is 99% chill when nothing happens, but 1%, but when that 1% mishap happens, you have to be on fire. So I'm not asking you to keep on nibbling your books anymore, but when you are inside the OT, give your 100%, no matter how boring it is the 99% of the times, because unless you keep yourself active and quick, that is mentally agile, you won't be able to handle that 1% panic situation. So whenever you are inside the OT, you'll have plenty of time and try to learn about the machine and the drugs which we are going to use left and right in our day-to-day practice. I am insisting on this because all these drugs and these machines are all Greek and Latin to us because we had little exposure to them in our UG period. So just learn while at work and have fun while you are not at work. If you do this right, I can assure you that you will never regret choosing anesthesia as your career after 3 years. Now let's talk about the minus points. First is medical legal issues. Anesthesia is a risky subject and risky branch, and anesthetists face more medical legal and ethical issues than any other medical professional. The importance of proper documentation and obtaining consent can never be underestimated. So practice that habit from the very first day of your residency. Second is fluctuating day and night work pattern. Some may not be a fan of this type of work pattern, and this is the case when you choose to do freelancing. But when you go to government setup jobs or private sector jobs, your duty hours will be fixed and this won't be a problem anymore. The next is, it is a dependent branch. This is going to be inevitable, and except for in government setup, you have to compromise, you have to be dependent, at least you have to be negotiating to some extent with the surgeons unless and until you are well established. But if you are going to towards critical care medicine or pain medicine, again this won't be an issue. So regarding salary, as a fresher you will be getting around 70,000 to 80,000 per month. if you go for a private sector job. But if you are freelancing, again, this is going to be tough for the during the early days, since you have to maintain a good rapport with the surgeons and make yourself readily available all the times whenever being called. And this might not be easy for some people who are planning to focus on families, especially females, after post graduation. In metropolitan cities like Chennai, Mumbai or Delhi, the pay scale will be much higher. So regarding super specialty, the options are plenty. You can do DM in onco anesthesia, cardiac anesthesia, transplant anesthesia, neuro anesthesia, and then critical care medicine. Otherwise, you can opt for short-term fellowships in pediatric anesthesia, pain medicine, IDCCM, which is Indian Diploma in Critical Care Medicine, IDRA, which is Indian Diploma in Regional Anesthesia, to specialize in nerve blocks. But are these necessary? In metropolitan cities, the hospitals may demand specialist anesthetists, but otherwise, if you are working in peripheral cities and towns, MD or DNB anesthesia alone should be enough as of now. And also, it depends on where you are going to establish your practice. Next, how to choose the college. First is count of surgeries. That is, choose a college where a huge number of surgeries are done to get good hands-on. Second will be, see whether super specialty surgeries are done in that hospital. Otherwise, if you choose a peripheral college, you will have to attend rotational postings in some other bigger institute, for example, in Tamil Nadu, Madras Medical College or Madurai Medical College, like that. The third will be future practice. You are lucky if you get a seat in a college which is located in a place where you are going to establish your future practice, so that you would have gained many acquaintance with surgeons, hospitals and seniors during your 3 years post-graduation period. Coming to abroad opportunities, there are also plenty in our field, in our branch, like FRCA, EDIC, IDAC, etc. Discussing them will be beyond the scope of this video, but my one advice is that if you are interested in doing abroad, planning to go abroad, you have to start researching early and start preparing early, and don't wait till your MD gets over. The same way, if you are planning to go in the direction of critical care medicine, you have to start reading medicine side by side during your MD period. So I hope that this video gives you a clear view about anesthesia, and if you are planning to take anesthesia as your career, I'm more than happy to welcome you into our BTS crew, that is Behind the Screen Heroes. Thank you and all the best.